When families get busy, especially with school back into session, right? It's easy to kind of slide into the fast food and let the exercise slip.
Yeah, something I guess a lot of us have been doing over the past couple months. It's important, though, for families to work together to be as healthy as they can, because we know kids want to grow up strong, make good health decisions about the future, and what we teach them now can help them do that later in life. So here to help families begin those good eating habits young is Dr. Gigi Chawla, Chief of General Pediatrics at Children's Minnesota. Dr. Gigi, thanks for being with us this morning.
Thank you for having me again.
Can we just start with COVID-19 and what kind of impact that's had on the health of our children? COVID aside, just the pandemic.
Yeah, you know, one of the things that we're noticing is that we're seeing a slight trend up in kids' body mass index. So that's a measure of their weight compared to their height. And I'm sure that there's lots of good reasons for that given COVID-19. You know, kids are not being as active and as they had been in the past. The kitchen is always open, so there's lots of snacks. Maybe adults aren't quite as good as understanding portion sizes as places like schools or even daycares can be. And then lastly, you know, the financial impact that high quality fruits and vegetables are expensive, and that is undoubtedly playing a role also.
So, you know, you talk about a couple things, the maybe less exercise outside, but the big one there is the healthy eating habits. You know, when does that need to start? We talk about, you know, just as they're even starting to eat food, it can start as early as there, but, you know, you might have a 3 or a 4 or a 6-year-old that's picky. What can you do there?
Well, you really want to think about those eating habits very early on. And so, you know, thinking about how kids need about 3 good meals a day with 2 snacks or so. So be very planful about those times, about what you're preparing. You know, a good place to start might be looking at myplate.gov. So that's the new updated version of the food pyramid. And it really shows you that half of every plate of food that you eat should be fruits and vegetables, with a small portion being your carbohydrates and a small portion being your protein. And setting that standard for every meal, every snack that kids are eating as well, can be really helpful. I think bringing the kids to the grocery store also, so that they get exposed to lots of things, and then having them help prepare meals and help think about those meals can be really helpful too in getting their engagement to eat more fruits and vegetables.
What about those ones that they're just stubborn, I'm going to call them, those really picky eaters that just refuse?
Yeah, you know, I think for picky eaters, don't let food create a conflict in your household. And so probably the first thing to remember is don't use food as a reward. Don't use food as love. Don't tell families, or don't have your kids understand that they have to finish their plate of food. Let them eat what they want to eat and set it aside. But then really engage kids in the preparation of all sorts of foods. Encourage them to try new things. If you're going to make sure that you offer them some new foods, maybe put it on your plate first so that they can see you enjoying it, you eating those great fruits and vegetables before they are willing to try it. Modeling that good behavior, modeling the diet that you want them to have is really the best step.
Yeah, and I know Jason, one of the things that he did is they got the kids to plant stuff in the yards, and when you plant, you know, you feel sort of this ownership of something that you're planting. And
that is spectacular. Right. That's exactly right. Get them engaged.
Right, awesome. Dr. Gigi Chawla, Children's Minnesota, thanks so much for joining us this morning. We appreciate it.